One of the chronic diseases you've heard associated with excess weight is diabetes. It requires a complete change in lifestyle to manage. There are many myths and misconceptions about the disease. Your best defense, knowledge, and a good plan.
The first thing I'm going to do is pick on you and give you a little test to see how much you know about diabetes.
This is a class for patients who have been diagnosed with diabetes. It's where they learn about their disease and how to manage it.
Did your doctor explain to you what happens when you have type 2 diabetes? No? Okay. All right. Well, what happens is pancreas is what makes insulin in your body. Okay? Insulin is just a hormone. Its job is to regulate your blood sugars. And in most people with type 2, it stops working quite so well.
Norton Healthcare offers a self-management class that's all-encompassing. We talk about what diabetes is. We talk about some of the myths people hear about diabetes. We talk about the complications that can happen from diabetes. We spend 2 to 2.5 hours talking about nutrition and what they should eat. We talk about exercise. We have pharmacists that come to talk about the medications. We show people how to check their blood sugars and provide meters if they don't have one already, in a kind of a 1-day or 2-day class setting.
Mary Kenealy is a clinical dietitian and certified diabetes educator who helps lead the class. She talks about food choices and portion control.
With diabetes, the portion is very important because, as you know, in America, everything has gotten bigger as far as supersizing and that kind of thing. So the food models are really helpful to show adequate portion sizes because people have gotten so used to eating bigger portions. And when I show like an ounce of meat, people are just shocked. And usually at a meal, you don't need more than 3 ounces of meat, and this would be like 3 ounces. So people think, oh, that's all I get to eat. But really, that's all the protein any adult would need, would be that much, per meal. And of course, the portion sizes for your other things too. It's very important. The portion size is very important.
Weight and diabetes has a huge impact because when our cells are plumper with more weight, they don't accept the insulin that our body makes as readily as somebody who is a normal weight. Insulin is the key that unlocks our cells so that the sugar can get in and our cells can then use it for energy. So if our body's not accepting the insulin as well, our blood sugars can stay higher and thus leading to the diabetes. So people who are overweight have a higher tendency of having diabetes because their cells aren't as receptive to the insulin that their body's making.
So weight loss can improve and in some cases even cure diabetes.
But those people, we say, your diabetes seems to be gone. But that's the only people we see that in, all right? But those are people that lose like drastic amount, a lot of weight, not just 20 pounds. This is people who lose over 100 pounds. So yes, bariatric surgery seems to be a treatment for some people with diabetes.
A lot of the people we see with diabetes come in who are overweight, and losing even 5% of their body weight can help improve their blood sugars, which for a lot of us is a very reasonable weight loss goal.